Hay fever is a common allergic reaction that 1 in 5 people will suffer from at some point in their life. It's a reaction or an inflammation of the nose, eyes, throat and possibly the sinuses as a reaction to pollen. People can suffer from it at different times of the year depending on what type of pollen that they react to. Tree pollen is normally springtime, grass pollen is late spring and early summer, and weed pollen can be in the autumn. The inflammation causes the quite common symptoms of a runny nose or a stuffy nose, red irritated eyes, and an itchy throat. There's no cure for hay fever, but there are many options that you can use over the counter that may help to treat the symptoms. They can be used on their own or they can be used as a combination of products. So the first product would be the antihistamines. They're available in tablet form and in liquid form. Most common examples are cetirizine, loratadine and azilastine. They can be used as a when needed basis if the symptoms are starting, and they may work, or they can be used on a preventative basis, so to prevent the symptoms from starting on a daily basis. The more newer antihistamines are less likely to cause drowsiness, but patients always have to be wary of that. Second option would be steroids, corticosteroids. They reduce the inflammation in the nasal passages and hence reduce the symptoms of hay fever. They are best used a few weeks before the symptoms start and on a regular basis. Third option is barrier sprays. They're drug-free, safe to use for adults and children, and they form a barrier in the nasal passages which prevent the pollen from causing any irritation. People that suffer with itchy eyes can use eye drops. Sodium chromoglycate is the most common ingredient in the eye drops that we sell over the counter. It's a mast cell stabilizer, very safe to use, very effective and quite quick acting. The last option is some self-help tips. Always handy to use something like Haymax, which is a barrier balm which is used on the inside of the nostrils to prevent the pollen from going into the nostrils and irritating the surfaces. Likewise, using wraparound sunglasses when outside can prevent the pollen from affecting the eyes, and also showering and getting rid of clothes while you've been outside can help get rid of the pollen and stop it from entering the nasal passages.